So we will start with Uganda, and I would ask Patrick or Bishop Gakumba to share with us how the situation in your country is, but also to introduce yourself.
And so, but it is not easy because people are now, it has changed the way we worship, and people now prefer to be online, to pray online or listen to radios. And that is why for us now, our prayer and plan is to have our own run Church of Uganda, that's of Northern Uganda radio. We have applied for a frequency, and we pray that we'll have our own radio so that we are able to now communicate or to preach the message on air and even online. Yes, people have died, including bishops. We lost a bishop, our neighboring bishop of Nebi. He died of coronavirus. And some priests. I personally was diagnosed with the COVID, but I was told mine was asymptomatic. So I never had any symptoms of anything. So I thank God that I'm alive, but people have died. And it has affected business. Some people's business, like bars, up to now are not yet allowed to open. And other businesses, some other business like entertainment, tourism, and all these, they are not yet up and running. And so currently there is a rise in the COVID situation. I think currently in Gulu is among the highest because we are at the border with Sudan, and so the cases are rising. But also people are losing their. At first, people were listening to the SOPs and observing social distance, but people have relaxed. They have relaxed now. They no longer want to put on masks, and they are gathering in large numbers, especially at funerals and at celebrations. So the people who are being vaccinated now are those essential workers like the army, police, the doctors, the teachers, and the people who are older, 60, 50 years and above with some problems like, say, diabetes, pressure, and other things. They are being vaccinated. But also there has been misinformation about the vaccine, safety, and so on. People fear taking the vaccine, but slowly by slowly, people are now getting to accept that because of too much information going around about some negative publicity about vaccines and so on.
Thank you, Bishop Gakumba. He is from the Diocese of Northern Uganda. We have a second bishop with us, Bishop Wilson Kitara, and we will go to Zambia from one African country to the other.
So I'm Deaconess Charlie from the United Church of Zambia, and I'm the one in charge of Community Development and Social Justice Department. So what we have seen as a result of COVID-19 is that we've seen losses of jobs, high cost of living. Most of the food stuffs and necessities have been hiked unreasonably. So you would find that people are suffering because of that. And in terms of the United Church of Zambia, in the recent past, especially in January, February, and late December, we were actually badly hit by the COVID-19. And so we saw most of the church workers and our members contracting the virus, to the extent of some of our loved ones dying. And amongst those people that died, a diaconia worker, a deaconess in the United Church of Zambia from Lusaka Presbytery, also succumbed to COVID-19. And the membership has been affected. People are still skeptical to come to church and attend church services, regardless of us having COVID-19 restrictions. And we've seen that the offerings have actually dropped down, and we have a serious deficit in our operational costs. And we've realized that because of this, the church is trying to work tirelessly to make sure that we look for more sustainable way of mobilizing resources. And all presbyteries are now forming investment committees, and we are discussing issues to see how best we can sustain the church. In terms of COVID-19 restrictions at national level, you would find that in most of the compounds, people do not still believe that COVID-19 is real. They think it's a disease for rich people. But generally, people are adhering, people are now accepting to be vaccinated despite a lot of myths around the vaccination and a number of false information. There's a lot of misinformation. But as a church, we are trying to make sure that the people adhere to COVID-19 restrictions and that they go for vaccination for them to be protected. So that is the stance of the United Church of Zambia as of now. Thank you so much.
Thank you very much. From UCZ, we have one participant. We have from Zambia, two more participants. Silomesi, we could not hear you. Can we hear you now? Oh, there you are.
Hello, Mr. Christian.
Oh, very good.
Then, in a nutshell, I think I'll just give an overview of what is happening in Sinazongwe district in relation to COVID-19. Indeed, we have received also a vaccine, AstraZeneca, in Zambia, and then it has rolled down even to the district level, as it is in other places whereby it's a voluntary exercise whereby people have to go on their own for vaccination. So the project is also busy trying to sensitize the community members so that at least they can receive the first jabs for protection. And then we are trying by all means using the funds which we got from Gossner Mission, the health support funds, to make sure that we become instrumental in the district in terms of like sensitizing the communities through drama programs. And then we're also facilitating for the transportation of the COVID samples for tests to the laboratories in Livingstone. So far, a lot of trips have been done, and then the district up to the government level, actually, they are very appreciative of what Gossner Mission has done in order to facilitate for funds to make sure that all these activities can happen. As we are talking now, we have even gone a mile further to make sure that we facilitate even for the clinics to make sure that they can, the Ministry of Health can access their clinics, the clinical staff so that they can receive the COVID-19 jabs. So far, at least all the clinics in the district have been covered, and the frontline staff, the health officers who happens to be the nurses and the doctors, have already received the protection. Then from there also, we are saying, as we are thanking Gossner Mission for the donation, we have realized to say at least the donation again is coming to an end, but we'll try to see how we can again talk to each other to see whether it can go to another phase. Otherwise, the government of Zambia is really very grateful for what you have done in Sinazongwe district. Thank you very much.
So now we go from Africa to Asia. So we would like from Nepal, either Kapil or Bibu Singh to tell us a little bit about the dramatic situation in Nepal about COVID-19.
Regarding the COVID situation in Nepal, it is increasingly, how do you say, it's a very fearful situation now. In the first phase, there were only about 3,000 fatalities, but now the death rates is increasing. Like 2 weeks ago, Nepal had the second highest COVID infection rate after Vietnam. That was like 51%. So the infection rate is fluctuating. It comes down for a couple of days and suddenly there's an increase. So it's daily, in an average, it is above 40%. So this death happens due to poor people not having access to healthcare and services. So experts say that maybe 50% of the death could have been prevented if the sick got appropriate and timely health services. There are migrants turnover. Every day there are thousands of people entering from India. We are bordering in India with India and it's an open border. So the government of Nepal has only like 13 to 14 entry points allocated for entry, but then people are, since it's an open border, people are entering from other unauthorized or secret hidden, entry points. And so even in the entry points where the government has authorized, there was not enough testing kits, PCR tests, antigen test kits available. So people are just taken temperature and sent in without any tests, which makes the community very vulnerable, and no measures to keep quarantine or isolation at near the borders. So they are home isolated. So the infection has reached the communities and the villages in the hills as well, whereas it was not so in the first wave. So we are still in lockdown, under lockdown in Kathmandu. A lot of the districts are under lockdown. So it started from April 29 and it's extended until May end, probability of increasing. Yeah. Bibuji, could you add on to this? Yeah, thank you.
Yeah, thank you, Balkumari Didi. And as Balkumari Didi has said, it's a really hard time for our country, and it's even harder than the 2015 earthquake that we had, and it will have long-lasting effects. It affects even more than the earthquake, I think, and it has already cost more lives than the 2015 earthquake. And as Balkumar Didi has said, Nepal is the one of the most affected countries at the moment by COVID-19. And all the hospitals, they are overwhelmed because it's it's in shortage. Oxygen and hospital beds is in shortage. And like Balkumari said, people are dying because of the lack of oxygen and no transportation. Some poor people, they are trying to take their relatives to hospital in bicycle and in tractors. They are trying to take the dead bodies in bicycle, and the situation is very, very bad. And as you know, we have got two hospitals, Tansen and Okhaldunga. So our hospitals, they are already seeing an increase in COVID patients, and then the number of COVID patients that are coming to the hospitals, it's more than what the hospitals can handle. Or we ask for your prayers. I think we need the church around us, global church, to stand with us in prayer and asking for God's mercy to end this wave, and to pray that this will pick up soon and then gradually come down the number of cases.
Thank you very much, Bibu Singh. They are both from an organization, umbrella organization or international NGO, United Mission to Nepal. We are members of this organization since a long time, since decades. But we have a second partner, Human Development and Community Services, and we have the executive director with us. Maybe you can also share a few words, maybe the dramatic situation in Nepal we have already heard about. Kapil?
Okay, greetings to you all from the SDCS, and thank you so much for this opportunity to share about SDCS work and in Nepal, the situation to you and for the praying. So Bibuji and the Balkumari, they already shared about the Nepal, situation of Nepal. So some more things I would like to add. Whatever you saw in the news, newspaper, the news, the government news, every day about 20,000 cases are testing, and among them 8,000 to 9,000 are testing positive. But actually in the reality, here are many people are suffering from the COVID, just so we can see our church members and our community people, just they are sick and they are living at home with the similar symptoms of the COVID, but they are not going to hospital, not tested. So we can imagine that the many cases are not tested. Many cases are here, but not tested and not identified. So we can imagine more than that the news we found by the government and other newspaper.
Thank you very much, Kapil. We will go from Nepal to India. We also welcome now Bishop Johan Dang from Gossner Church.
We are in the situation of lockdown and shutdown also. Saturday and Sunday is shutdown period, no shopping, nothing is there, totally closed down. But lockdown, we have time, morning 7 to 11 or 12 o'clock, we can have our provisions and vegetables from the market. But other markets are, other shops are closed, nothing to buy anything for the daily uses. This is also one problem. So people are suffering, and we have to follow the guidelines of the government. And therefore, we have, in lockdown period, we closed our church services. We closed all colleges and institutions. So our students are somewhere and somehow they are not able to get education in this time. So we have so many subjects to pray for unemployment, for our agriculture products, because agriculture sector, they are suffering. They have products, but there is no market to sell out. So the farmers are very awkward position, how to sell their production to the market. Limit time and no communication things are there, because our bus are stopped, no privates are allowed. So it is very difficult to go one place to another place. So this communication is little bit very difficult to go one place to another place, one district to another district. We have to get the e-pass, then only we can travel. So these are the things always we are facing, even the common people, but in the government, they have to take care of. But government is not serious. We see last month they have the election in the West Bengal, and they have so many rallies. Prime Minister, Health Minister, and other home ministers, they had their own rallies, and they have affected many people because the crowd they came, they did not follow the guidelines of the government. These are the negligence from the government side. We see as Indian citizens, we can see how our government is taking care of. But we pray for the government to have a good knowledge, understanding, and wisdom, so that they can serve in proper way to our nation. So
thank you, Bishop.
So much I see. Thank you.
We have a second partner from YMCA Ranchi. We welcome General Secretary Jonas Kujur.
Good morning. This is Jonas Kujur from Ranchi YMCA. Namaskar and Susahai. And my name is Jonas Kujur, and I am the General Secretary of Ranchi YMCA. Can you hear me?
Yes, we hear you.
Yeah. So, moderator John Jang has already said about the Indian situation, what we are having in this COVID situation. So everything is locked down and everything is closed here, even in Jharkhand, Ranchi also. And our office, YMCA office is closed. Our project area is closed because so many staffs are affected by the COVID-19. And you must be knowing that we have the difficult situation in India about our healthcare, vaccination, and whatever you say, everything is messed up, and so many people are dying.
Our situation actually is a little bit relieving in the moment. We had a lockdown, restaurants were closed, many shops were closed for a long time. Now things are getting a little bit better. We had a third wave. Of course, we are now a little bit frightened about the new mutations which are around, so they might also hit Europe soon. We don't know. There's a vaccination rate is rising. We have about I think 1/4 of the population is now having had the first dose, and it is rising quite quickly. But nevertheless, the situation is still not relaxed.
Hello, my dear brothers and sisters. I'm so happy to meet you again. And I think we should go on like this, to learn from each other, to know about each other in our current situations, and to pray for each other as well. So it's not only about financial support, but it's also about praying for each other. And I think this must be the first and the last. So I'm very happy to be with you. Thank you very much.